Hi. First, a warning. I have been sitting this morning having a very lovely morning, catching up emails, catching up on messages and other bits and pieces while drinking iced latte in the sun. Now, the warning, I had 3 of them. So if I end up talking a little bit quickly, that would be why. Now, I know there's a lot of fear in our communities at the moment, and I wanted to touch base and just remind everybody to check their sources, look at what they're basing their assumptions about health and wellness on. Obviously, I'm talking about coronavirus, and it's going to be different depending on which part of the world you're in. Here in Melbourne, we've had 3 new confirmed cases. We've had a couple of schools that have closed down for short periods because staff have been unwell. And then this morning there's a very excited headline, schools to close, which when you just headline surf gives you a jolt of fear. And I think parents would be terrified to hear that schools are closing until you read the whole article. So I want to just talk about communication. I just want to talk a little bit about how we're speaking to each other, how we're sharing information, and how we're also communicating within our business. So one of the things I did this morning is I actually yesterday I did a live video into my Quiet Confidence Foundations group where I talked about strategies for private practice owners to talk with their staff about health and well-being, to look at their policies around leave, but also for those of us with clients to talk about ways that we can manage our clients' needs without getting unwell. So trying to walk the dog, talk, and have a belly full of 3 iced lattes isn't working well for me this morning. So one of the things I have done this morning is send an email to my management team in my practice and proposed a meeting to really reiterate our own plans and strategies and policies around these things. So what I want is for a really clear message. So my team is very clear on what our policy is around clients attending, what our policy is around cancellation fees in the event of people needing to quarantine, what our policy is around staff attending if they're unwell or they've been travelling, or if they're required to quarantine for other reasons. So bear with me while I cross Toorak Road. You right, darling? Yep. So one of the things that is really important is identifying where you're getting your information from. Now, some of the media sources have been really great in trying to be measured in how they're speaking. Some of them are not so much. So if you're basing your information on media sources or social media sources, it can be really tricky to try and find a clear line of advice to provide clear directions to your staff and to your clientele. So for me, it's actually been difficult trying to resist the temptation to jump every time there's a new media article and talk about that new issue with my audience, you guys. Because I haven't wanted to add to any scaremongering and I haven't wanted to add to any confusion. So my philosophy has been to just sit with information that I can get from government departments and my governing body like the Australian Psychological Society. Now that means this morning there's been a big announcement about telehealth, which affects my profession and my team directly, potentially. We don't have a lot of guidance around what it actually entails yet. So unless, of course, that guidance has been released while I'm busy yaffling to you. So all we have to go on at the moment is a media release about that initiative. So for me, it's been really about sitting on my hands this morning and making sure that I wait before giving fuller information to my population of viewers on social media, my team, and of course our clients. So I need to just wait and be measured. And I think this is probably something that we really need to take into account in our communication style generally. So one of the things that is really valuable in a situation such as we have at the moment, and I've talked about this before, I talked about this with Mark Drager in our podcast the other day, how crises in our businesses can actually lead to new strategies, new policies, new procedures that really help your business anyway. So if right now one of the key things for me is learning to bite my tongue and sit on my hands until I've got the correct facts to share with people, that's not a bad thing. It's not a bad thing for me to make sure that I'm measured sometimes, depending on what it is I'm talking about. Of course, there are plenty of occasions where it's easy and appropriate to jump on and do a live stream talking about something exciting and new before you've got all the facts, but not when it's something to do with public health. So as a psychologist, one of the key things that I've been watching with interest is the community psychology elements to what's going on within our community, within other communities overseas, in the wake of health fears. People's behaviours, what's driving people's behaviours. Obviously in Australia we've had a toilet paper crisis. I think in other places it's soap or rice or pasta. And the psychological elements that are stirred up by the communication within the media. So for me, I guess it's about observing some of that, learning some of that, or learning from some of that for our community going forward. So one of the things that I hope is a massive positive that comes out of the current health crisis is an understanding of how we as a society interact with one another and what we can do better in future, how we can communicate more clearly. So as a psychologist, I used to work quite prominently within the suicide prevention space. I used to run workshops for the community on suicide prevention, and I was quite aware that there were very clear guidelines around reporting of suicides in the media. I wouldn't be at all surprised, and I really hope that one of the things that comes out of the current situation is clearer guidelines for the media about how to communicate public health concerns, because we certainly have seen a lot of fear-mongering, which doesn't help. It actually does harm, and that is not what we need as a community going forward. So how we communicate both amongst ourselves on social media, within the broader media, but also with our teams and with our clients, how we communicate can make all the difference in terms of the response and what follows next. So take a minute today if you can, perhaps in the sunshine, perhaps with an iced latte of your own, and just have a think about what message you want to give to your team or to your clients or to your colleagues, how you want to be communicating, and also what you need in terms of communication. So I would also hope, well, I know that my team are quite comfortable coming to me when they need clarity and guidance, and I would hope that you would also be able to approach those who can help you get clarity and guidance, whatever it might be. It doesn't have to be to do with this health crisis. It can be to do with anything in particular, to do with your work or your business or so on. Right, so have a fabulous day. I think what's really important right now is to just remember that if we work together, if we communicate sensibly, if we share nicely, if we play nicely, we will get through this current health crisis as a better society. And that's, and again, that's where I mention the community psychology elements. Pardon me. So take that 5 minutes in the sunshine with your iced latte today, and just, even if all you're doing is journaling and having some thoughts with yourself about how you're talking to yourself about what's going on at the moment, how much fear you're allowing yourself to engage in, and whether or not there are some practical and simple and straightforward things that you can do today to change your experience of what you're going through at the moment, what we're all going through at the moment. Because the way we talk to ourselves is just as important as the way we talk to each other. Have a fabulous day, and I will talk to you very soon. Bye for now.